We'll also talk about entering in referral sources, how to do that, and how to attach those to your patient. We will talk about exploding codes. So what are exploding codes? How do you create them and how do you use them? We will touch on Intellicare Alerts. We will talk about the schedule. We'll go through details in the schedule, how to schedule patients, how to do a proper walkout and take a payment. And then we'll also talk about the FAQ, how you can access that and utilize it for help and also view webinars from there. So I'm going to go ahead and share my Eaglesoft here. Let me go ahead and close this. Can everyone hear me okay? Can everyone see my Eaglesoft home screen? If you could just type in the chat for me. I just want to make sure we can all see and hear. Thank you, Rosie. Okay, so our Eaglesoft front office home screen here. When I mention the FAQ, and I kind of want to mention this in the beginning here because throughout the webinar today, I'm going to be giving you some FAQ numbers. And the way you're going to access your FAQ, there's a couple different ways. So from this online tab here, you can select FAQ. Thank you, Carly. Thank you, Anne. From your help, you can also access FAQ. There is another way, and a nice little tip I always like to, oops, didn't mean to do that. I'm so click happy. A tip I like to tell my new users is on your keyboard, if you click the F2 key, it's going to go ahead and populate the text here. So if you click on this particular picture, it's going to take you to the schedule. So it's kind of a nice trick for the new users to see exactly what's going on that front screen there. But if you click on this live help picture frame, you can also get the FAQ from there. And the FAQ, if I click it here, I like to call it my Google for Eaglesoft. So you're going to get this screen here. You can type in any keyword. If you're having trouble with fee schedules, you can type in fee schedule. And it's going to go ahead and search fee schedule for you. And today am going to be giving you some numbers. So if you type in, let's say I give you number 15698. You type it in, you hit search. It's going to go ahead and give you information on that topic that I'm talking about at that particular time. So the first one I am going to give you is this 15698, and it's about adding or creating a new patient. So when you click on these plus signs here, you can actually get screenshots. So you not only get the text, but you'll also get pictures to really walk you through how to do something in Eaglesoft. So it's a great tool. Again, that's the first thing I point out when I go into offices to train. It eases a little bit of anxiety for my new users. So just a nice little tip for you there. You can also, if you want to spend your Friday night at home, with a glass of wine, you can access that FAQ if you type in your browser, patterson.eaglesoft.net, and I'll type that in and I'll just show you what you'll get from there. So let me pull my screen over. If you type in patterson.eaglesoft.net, you're going to get this screen here. And what you can do is you can scroll down to the bottom and you can get FAQ. You can also get webinars. So very, very easily accessible from home if you wanted to spend your weekend learning about Eaglesoft. So let's get the screen back up here. Okay. So first, we're going to talk about entering in new patients. So there's a couple different ways you can accomplish that. So if you're on your front office screen, you can always come up here to Person, and you can click New. Okay. You can also go to List and click Person. Same thing, you could click New. Account. So you would go ahead and click on this blue hyperlink, and then you could click New. So anytime you see a word that's blue with an underline, that's a hyperlink. If you click it, it's going to take you to a list of more information. Now, if you're working from the schedule, you can also get to the account and create new, or you can come into this snowman with the pencil in his head, I like to call it, and you can click on this. And then you can also, oops, you would have to click on a blank area in the screen here. Click Edit Patient, and then you could hit New. I'm going to go ahead and go back to my front office home screen. I will click Person here. Now, one thing I like to kind of recommend is if somebody calls your office and they want to become a new patient. Now, if you're an office that's been open for quite some time, several years, I always like to just click this Show Inactive button here, because there is a possibility that maybe they were, a patient years ago, and, maybe they just came in once and they just don't remember. So I like to click that, and then I'd like to search their name before I go in and I enter a new patient. So if his name is Joe Smith, I can come down here and look at this. I see someone who is light gray versus black. The light gray means that they are inactive. The black text means they're active patients. So if I double click on Joseph here, I can verify, his information. And if indeed it is the same person, I can activate him again. If it's not, I'll just hit no, leave him inactive. That way you avoid duplicating patients in your system. So that's just something, again, I like to check. I always like to keep this button checked too, this auto search, because as you're typing, it narrows down the list for you as you go. You can also search by, first name, last name, patient ID, home phone, work phone, cell phone. So there's a variety of things you can search by here. I usually just search by last name. Okay, so say our patient is not in the system. We'll go ahead and hit New. And now we have what's called our New Person screen. So a couple things to, really pay attention to here. We have the option to mark this patient or this person as a patient, as a policyholder, and a responsible party. Now, this person may be one of these things, two of these things, or, all of these things. So we have to really know who we're entering in, because if this person is just a policyholder, if they're not actually coming into your office for treatment, they wouldn't be a patient. So in order to keep your reports accurate, I would just really, if it's just a policyholder, say it's a child coming to the office, or a spouse, maybe the policyholder has their own dentist they go to, they would just be a policyholder. They wouldn't necessarily be a patient. So that's something to really consider. So yeah, the patient gets treatment in the office. The policyholder is holding the insurance plan. And then the responsible party is, who pays the bill. So we know it's not always the same. So that's, again, something to keep in mind. So let's just enter somebody here. Let's just say we have Robert Brown. And we have the ability to enter a middle initial, a preferred name. So if he does like to go by Bob, we would enter that there. And you also have this salutation field. Some people will just, put this for every patient. Some offices will use this as a trick to kind of know that, hey, Robert Brown is a doctor and he likes to be addressed as Dr. Brown. or just Mr. Brown. So if they look in there and they see that this field is actually selected, they know that they should call that patient, by the proper salutation. Otherwise, they can just leave it blank. So you can use that as you wish. It's just a nice little tip that I've heard offices use. And we're going to say that Bob Brown here is going to be a patient. He will receive treatment from us. He is his own policy holder. So once you click that, you'll get this window here. And it's asking if you want to assign him to be the policy holder. And then you'll see it will automatically check here under primary insurance that he has insurance, and it's going to put him as the actual policy holder. And we'll get into entering that information here shortly. He is also his own responsible party. So we're going to, after I enter in Bob Brown, we're going to enter in a family because I'm going to show you, how you would enter in, a child. So we'd want to enter in the responsible party first, and then the policyholder, and then the child, because we could link it all with just a click of a button and not have to retype everything multiple times. So we'll enter Bob Brown's address here. I'll just make something up. Bob Brown lives on Brown Street. And when you tab in Eaglesoft here, it will take you to the next line. And it will automatically capitalize for you as well. So you don't have to worry about capitalizing. Unless it's a last name like McDougall, you would have to capitalize that D. So we'll go to cell phone here. That's important if you're going to be doing your text messaging. And we even have a pager field for those who are stuck in, 1990. The sex here. So you can, into this field, if you use your left and right arrows, you can toggle back and forth and select the appropriate sex. It always defaults to female. So we would change it for Mr. Brown here. Your marital status and the birth date. Okay. And then social security number. So we could enter in the social number. And the cool thing about this is once you click into the next field, it will start out or hide those first 6 numbers there. And if you need to view the numbers again, once you click back in there, it'll show the numbers again. So a nice little security feature there. I do understand some patients don't necessarily always want to give their social number, so but that is an option there in that field. Now the chart ID, initially this was used for offices that, were converting from paper charts and they had a chart ID and they could go ahead and use that field. But, I don't really see the need for that. Some offices get really creative there. And if you're an office that has multiple doctors, they could even put the preferred doctor in that field. They could also put, maybe if it's a Medicaid patient, or if you have a dental savings plan your office uses, you can always write DSP there. And that way, that patient is on your dental savings plan. So get creative with that field. You can also leave it blank. You don't need to fill it out. We also have the driver's license number field. I know some offices don't get that. I think it's a good thing to get, just to help prevent fraud. Just seeing the picture of that person in front of you, because being in this field, I have heard stories of, people impersonating other people and getting treatment done. So also, from what I understand, it's easier for the collection agencies to track somebody down with the driver's license number versus just having that social number. So something to think about. Email is important as well, because in this day and age, that's how we communicate. So for the most part, I think everybody has an email address, especially if you're doing those, email confirmations, you'd want to have these checked here. So receives email and receives text if you have the cell phone there. And then we'll get down here to the benefits. So Eaglesoft attaches the insurance plan through the employer. So the first thing, you enter for that patient would be the actual employer. And then that has all the plan information in it. And we're going to go through how to enter all that. And then the insurance company is actually tied to the employer. So for this patient, I'm just going to come in here and say his employer is already listed in here. I'm going to go ahead and just say he works for Abbott Laboratories. So I can see in the title I have put here the 25/1500. That's just a shortcut for me to know that this is the plan with the $25 deductible and the $1,500 maximum, because we know that employers offer, different levels of coverage. So it's just nice to have that in the title so you don't have to really go searching. So I'll select use and it's going to bring that information in here. Now, if there's secondary insurance as well, you can enter that too. And then we also have the ability to enter in supplemental. So a third insurance, a lot of offices, use that for medical insurance. If you're using electronic claims, your primary and your secondary do go electronically. However, supplemental does not go electronically at this time. So that's something you'd have to print out and mail. This up here, this is called the recall note field. A lot of offices have no idea what that's for, but it's a little box that you can enter in information that could be helpful. So some offices would use this for maybe if they alternate 3 months, with perio. You could enter that in there. Some offices will, if it's a denture patient, they'll type in denture, or an implant patient. What you can do from this field is there's an area in Eaglesoft called the Money Finder, and you can actually query this recall note field. So if you wanted to send out maybe a marketing piece or a campaign to all of your implant patients, you can actually query that in the Money Finder. You can look at the Money Finder. The FAQ number for that is going to be 9866. And you can get more information on that, but you can get creative in there as well. This next recall. So this is yellow here because this is a new patient. He's never had a recall with us. Once we walk out a recall appointment, this will change to what his next recall should be. Now, if this is a new patient and he told you, he just had a cleaning a month ago at a previous office, you can go in there and enter in that date if you'd like. Under appointments here, next preventive. So if there is a preventive appointment scheduled, that date would show here. We also have next regular, which is a next appointment with the doctor. So if there is an appointment scheduled, that will show there as well. You have your check marks here for your Hipaa notices. So as a new patient, we all typically have them consent to, our Hipaa forms and privacy practices. So once they do complete those forms, you would want to check mark those and make the date accurate. Now, if you're using RevenueWell online forms, they could fill out those forms through RevenueWell and it will automatically check these boxes and put the date there. So that's pretty cool. And I don't know if any of you are using RevenueWell forms, but if you are, it integrates and it syncs right in. So if your patient fills out, their name, address, all that patient information, that'll sync in there as well. So it's a really good tool. I know Opera DDS and Solution Reach, I think, do, the same thing. So something to think about. I know we're not really wanting to pass a lot of papers and tablets back and forth anymore, so it's an option. But you can also use in Eaglesoft, there is fast check-in, which will allow them to fill all this information out on, a laptop or a kiosk or a tablet in the office when they arrive. So that's a great tool as well. Okay, so we pretty much have this patient, we have all the information entered we need for this patient. So I'm going to go ahead and hit OK. And now from this point forward, when I go into Robert Brown's chart, I'm just going to hit last person here. And I can double click it. It is no longer a new patient window. It is now the edit patient window. So you always have access to this. It holds a ton of information. We're going to go over all of these buttons here as well, so you know exactly what those are for. But what I want to do next, I want to actually enter in a family, because it can get a little tricky again when you have maybe divorced parents and perhaps the father holds the policy and the child lives with the mom, right? So we'll go over that. Again, that new patient entry FAQ is 15698 if you want to write that down. So I'm going to go ahead here and hit new again. Are there any questions yet? Again, for those of you that weren't on at the very beginning, you can always use the chat, or you can unmute your line and just yell out to me. Thanks, Rosie. All right, so we are going to enter in a family here. Now, as I mentioned before, what we want to do is enter in, the responsible party first. So if we have maybe a teenager coming in and it's a divorced family, the teenager lives with the mom, but the dad holds the policy, we would enter in the mom first. So is the mom going to be a patient in the office as well? That's, something you want to find out too. So let's just say she is. And her name is Julie. So we're going to go ahead and enter in Julie first, because she will be that responsible party. I'm just making up names here. Her preferred name, she just goes by Julie. She's laid back, so she doesn't need to be called, Mrs. Wood here. So we'll move on here. So she is the patient, and she's also the responsible party. And we'll go ahead and we'll enter her address. I'm real creative here, right? Wood Street. We'll just put Effingham, Illinois. Again, when we tab, it'll go ahead and take us to the next lines. If she wants to give you her work phone, great. Female. Let's just say they're separated. They're not quite divorced yet. And then her birthday. And we'll put a social number in here. And a driver's license number. Okay. Okay, and again, make sure to check your boxes here to receive email and receive text messages. And then we're going to say, since they are still married, she does have insurance, but she still has it through her spouse. So once we enter in him, then we'll go ahead and we'll attach it to her. So right now we have her in as the responsible party. So I'm going to go ahead and hit OK. And then I'll hit new. And I'll enter in the responsible party, the spouse here. Or sorry, the policyholder. He, however, will not be coming to the practice. So he has his own dentist. So he's merely just going to be the policyholder. So once I click policyholder, again, it's going to ask if I want to assign this patient to be the policyholder, and I'll say yes. So it's going to automatically check that box. And he does have to be his own responsible party. So every patient has to have a responsible party. So he will be his own responsible party. And we'll go ahead and we'll come up here. I don't know necessarily that you're going to need all of that communication information for him since he is the policy holder and not necessarily the child's responsible party or the wife's. So if you want to get that information, you certainly can. Now, we want to enter in his employer because the employer holds the benefits. So let's just say he works for Apple, but Apple isn't in our system. So we're actually going to want to enter in that new plan. So one other thing I want to point out is you can search, by name of the employer. You can search by insurance company and you can search by group number. So if you click the header here, group number, you can type in the group number and search by that as well. So I'm going to go ahead and enter new, and we're going to call it Apple Inc. For the employer, you don't really need an address and a phone number. I mean, unless you're going to be marketing to these employers, that's information you don't really need. What you do need, however, is you absolutely need the group number. And then you're going to want to have that information in here. So the deductible. Now, as I mentioned before, some companies have multiple, benefit plans to choose from. So some may have a benefit plan specifically for their high, ranking CEOs or managers, and some are just, for the employees. So, I would like to enter that info into the title, but let's just say we have a $50 deductible here. And for the maximum, there is a $2,000 benefit there. And then what I'll do is I will enter in again the 50/2000. You can also enter in, maybe the date that you're putting that employer into the system. So that it's current and up to date. Some offices do that. One other thing that's important here is the beginning month. So when does this plan reset? That really needs to be accurate if you are, in network with insurance companies, if you're taking insurance, because every month and every year when you process that end of period, you're going to reset, the benefits for that month. So I know most plans do start over in January, but there are some, maybe school teachers are right before school begins. So maybe in July, or, I know some union workers are different. So I would make sure you have that information correct as well. So I wanted to give you an FAQ number here too for adding an employer. That would be number 9899. So you can search that for more info here. So now you're going to go ahead and attach the insurance company. So I'm going to click on the list, and let's just say we have Delta Dental. So one thing too, you want to make sure, because it gets kind of tricky when multiple people are entering in insurance companies. The software is really picky. If one particular letter is capital, and you enter in the same exact insurance company, not realizing it, and you don't capitalize that letter, it creates a duplicate insurance company. And I see that happen a lot in offices, and that insurance list gets just out of control. I've seen, 2,000 insurance companies in a list, and I don't think there's that many insurance companies out there. So you really want to try to keep this clean. If you're going to enter it in as P.O.box, make sure you do them all that way instead of, P.O. box without the periods, because again, you're going to have duplicate companies. Now, in my demo database, I have some duplicate companies here, right? So just to kind of demonstrate what can happen, and you can have patients attached to each of these. So you can't just go in there and delete them if you have patients attached. So try to keep it clean. There's a utility you can run under utilities to remove duplicate insurance companies, but it has to be matched to the T. So again, if you have PO box versus P.O box, it won't recognize that as the same company. So just be careful about that. So we'll say he has Aetna. Let's go in here. I'm going to edit it and we'll take a look at this. So you need the name, address, and phone number. You know, we need the address for sure. We got to get those claims there. And the phone number. You can also enter a payment group for that company because you can do bulk insurance payments in Eaglesoft. So under activities, you'll have that bulk insurance payment. You can search by payment group. And you'll need your claim payer ID, right? So most of us, I think, are doing e-claims. And then for attachments, so in FAQ, you can search, claim payer ID, and that is number 5071. So we know these payer IDs are kind of like zip codes, like they allow the claims to be sent to the correct insurance company. So we want to make sure those are attached. Same for your NEA payer ID or your attachments ID. We also have this field here, payment source. This is going to be, this is a commercial insurance company. And down here, you can see all the employers that are currently, attached to this insurance company. So I will hit OK. And let's go back in. I'll hit use. Back into the employer list. Now we have Aetna attached. And why is this here? There we go. Doing e-claims, you'll have your electronic submit here, but if you are printing claims, you want to pick the most recent blank ADA form. And then if you are contracted with insurance companies, hopefully they give you their fee schedules. Having the fee schedules entered into here is really going to help your insurance estimates be a lot more accurate. So I don't say 100% accurate because we know that I don't think, that always exists. Sometimes they change things on us, but we'll get a pretty good estimation if you have your fee schedules in here. If you don't, you want to enter in your percentages here for that insurance company of coverage. If you don't enter them in, it's just going to go by the default that was entered into Eaglesoft when the software was set up, when you first set up your Eaglesoft. So with fee schedules, if you have one in there for Aetna, you can certainly go in there and select it. If you don't, you would click on fee schedule. Now I'm going to give you an FAQ number for fee schedules. The number is 12470. And that'll walk you through how to set them up. But I'm going to go through it here, real quick. So if I need a fee schedule for Aetna, I can click on new, and I have some options here. So the first one would be automatically setting up all service codes. So this is going to give you the whole list of ADA codes, which we know is a lot. And, you probably don't do all of those services. You can individually set up service codes. So if you pick that, you're going to have to manually go in and enter each service code and then the corresponding allowable fee. You can also select this utilize an existing fee schedule. So what I like about this is you can pick, let's just pick this Blue Cross Blue Shield. So when you went in and entered, or when, whomever in the practice went in and entered their very first fee schedule, they had to go through that entire ADA code list and delete codes that you guys don't use or would never use. So they really kind of cleaned up the list here. So now when you build off of a fee schedule you already have, you're not going to have to go through hundreds and hundreds of codes to enter in the services that you do or that, are covered. So that's kind of nice. So you can rename it. We'll call it Aetna. And I do like to put the date in here as well, that the fee schedule was, created, not the date that you get it, but on that fee schedule, there should be a date. So that way, maybe once a year, you should check if there's any changes to that fee schedule or call the company and, negotiate, higher fees. So it's nice to have that in the title. That assures everybody that your fee schedules are up to date. Now, at this point, you can go in and let's just say, for Aetna, the allowable fee isn't 28, it's 25. So I could type in 25 and hit tab to move on to the next line, or you could just use your mouse to click in. Don't hit enter. If you hit enter, it's going to close out that fee schedule and you'll have to go right back in there. So you'll probably do that a couple of times before you realize, nope, I'm not going to hit enter. I'm going to hit tab. So let's just say for the limited exam, they cover 40, tab, comp exam, 47. Oops. So you kind of get the gist of that there. Now, if this fee schedule, so maybe the Blue Cross Blue Shield that, we're building this fee schedule off of didn't cover, let's just say a night guard. But we'll say maybe Aetna does. So if there is no coverage for a service, I want you to delete it out of that fee schedule, because if you leave it at 0, it's basically saying they're covered, but the allowable fee is 0. So you'll have to kind of give that away for free. So if there is a service in here you're not covered for, go ahead and just delete it out. Now let's just say in the Blue Cross Blue Shield, it wasn't covered, so it was removed from that fee schedule. But we do have some coverage here. You can come in here and click add, and you could add in that code in the fee. So you can delete and add as needed for each individual plan. Okay. So that's how you would build off of an existing fee schedule. Again, if you wanted to individually set up codes, you'd have to type in them individually. And of course, if you picked the other method, you would just have to go through that complete list of all the ADA service codes, which is, long. That's why the first time you enter a fee schedule, it's going to take you a while, and it's helpful to have 2 people doing it. So that's fee schedules. Now let's talk about the adjustment type. So the adjustment type, if you're contracted with insurance companies, we do advise you to go ahead and create an insurance adjustment type with that insurance company name. Because if you do that, you can run reports and you can see, how much you're adjusting off for each insurance company and if it's worth it to you, or, if you want to go in and negotiate fees as well. So, if you wanted to do that, you would hit new and then you could type in the name of the insurance company and then go from there. But we have an insurance or an adjustment in there. So I'll just click use. And what you're going to do is when you get that insurance payment for that claim, that window will pop up after you enter in that payment. So if there's anything you do have to adjust off, it'll show in there as an Aetna adjustment. Okay, so let's talk about this notes field here. This notes field can be viewed from several different areas in the software. So this is a spot where you're going to want to put the frequencies in there of that plan. So your frequencies of, let's just say the full mouth would be every 60 months. Right? Sorry, I have to tab it. And let's just say, bite wings once a year. And pro fees 2 per calendar year. You get the idea. And so on and so forth. You can actually create a template if you wanted, like a Word document, and copy and paste this, the template into all of your employers and just kind of fill it out accordingly. But this notes field, again, it's going to show up in the chart. You can you can see that in the account and also in the walkout and in the treatment plan. So from the chart, the clinical team can view those frequencies so they don't necessarily have to come up and ask you what those frequencies are. So that's a really great feature to use. All right, so we have our employer entered. Now I'm going to go ahead and hit use. And we have the information there for that policy. So I will go ahead and hit OK. Now we want to enter in the child. So I'll hit new. And let's see, we will call this child Michael. And we'll tab it. Again, you don't have to use caps because it will automatically capitalize for you. And he definitely is going to be a patient. However, he is not the policy holder or the responsible party. So once I uncheck responsible party, I can now come over here to the hyperlink and select the mom because he lives with the mom. She brings him to the appointment. She pays the bills. So we'll go ahead and double click on her. And now it's going to bring all of that relative information in there. Now, if for some reason she was the responsible party, but he didn't live with her, you could go in there and override that as well. Okay. We'll go ahead and check off the sex and the birth date. Okay, age 2016. Oh boy. Okay, he is 16. He may or may not have a driver's license yet. He probably has an email, but we will be sending those to the responsible party anyway. And then he does have insurance, right? So we're going to click insurance, and now we're going to go link his father as the policy holder because he holds that policy. So it brings it in there. So it really does make it a lot easier, to have those two people entered in before you enter in that child or dependent. So you don't have to go in there and, enter everything multiple times. All right, great. So let's go ahead and talk about all of these buttons here on the right-hand side. One thing I want to show you real quick, I want to go ahead and hit OK. If we go into Julie's, the mom, Eaglesoft links people to an account by the responsible party. So we can see in Julie's account, we have Michael here. Now the husband isn't there because he's not, Julie is not his responsible party. So if you want to have, a married couple in your system and you want them to have separate accounts, which I highly recommend, you got to make each one the responsible party. I mean, they could still have, each other's policy, but as long as they're different, responsible parties, they'll have their own account. It just makes it easier, I think, even though you can really filter the account screen good. To me, it's just a lot cleaner for them to have their own accounts. But let's just say we wanted to go into Michael's chart from here. We could right click, right? And you can switch to, and it'll take us back into his screen here. All right, so moving on here, we'll talk about the registration. So this registration, this is something, you can print out for them. This is also something that would be, on your fast check-in or your revenue well forms. But if you did want to print that for somebody to fill out, you can print it. You can print a blank one which would look like, let's see if I can give you a print preview, which would look like this. So everything would be blank. Or you can print it as is, which would have their name, right? It'd have all this information in here. And you can also print it without information in the defaulted field. So if for some reason, and we'll talk about this, you have already set up their preferences, it would have some preferences in there like preferred dentist. So if you were updating this, maybe every few years, you could do that in there and then just change accordingly. Preferences. This is a great and very important screen. The important parts of this screen are going to be your primary member ID. So this is where that insurance ID will go. And we need to go talk about that real quick back on the employer screen. But for now, if we have a primary member ID, a secondary member ID, if they're Medicaid, right, you got to have that member ID in there. We also have some preferences here. So if they are someone that always prefers morning or PM, you can mark that. If they tell you that their schedule is very flexible, that they are someone who is available on short notice, you can check that as well, because there are reports and filters you can run to narrow down these specific patients if you're trying to fill, a last minute opening, especially like in that quick fill list. The software does keep a tally of their failed appointments, canceled, or neither in various areas of the software, but this is just one of them. If they are someone that requires pre-med, you can check this here. It will then populate a little pill icon on their appointment on the schedule. Now, you won't necessarily get a pop-up window for that. If you wanted a pop-up window, you would have to do that in a patient alert. But this will put a pill on that appointment on the schedule. And then if you wanted to attach a template, like a pre-med amoxicillin template, you could do that as well. If this is an ortho patient, you could mark that here, put the months of treatment, date treatment started, insurance billing frequency, and there are reports you can run for those. Some offices, actually a lot of offices, if this is just, going to be an ortho patient and, general dentistry patient, they'll create a duplicate account for that patient and they'll put their name in all caps, and that would be their ortho kind of account, so they could do their billing a lot easier and, enter in that insurance information kind of separately from their general dentistry. So a lot of offices would do that. We also have up here, so you have this discount. So if this is someone, maybe it's a senior citizen and you want to give them, a 10% discount on everything, you could go ahead and attach a discount here. We usually recommend just doing adjustments because you can run reports for, adjustments. You can have an adjustment type called, senior discount. And then at the end of every month or every year, you can run a report to see how many, senior discounts you're giving throughout the year. You can't run reports for actual discounts, just for adjustments. So something to think about. This fee schedule here is not a fee schedule for an employer. So I really think this is going to be left blank, most of the time. This would be designed for someone who doesn't have insurance, and maybe maybe you have a special, dental savings plan fee schedule or friends and family fee schedule. I would just leave this blank because what happens is offices may mistakenly enter in an employer fee schedule here, and then it's also entered in that employer section, but this one here overrides that. So if the employer fee schedule is updated or changed, and this one isn't, it's still going to pull from this one, and you're going to get wrong estimations. So that's a very important piece of information. So I would really not use this. Preferred dentist. So if your office has more than one dentist, I would select the preferred dentist. That way, every time you schedule an appointment, it would populate with this provider. You can always change that in the appointment, but this way you don't have to change it every time. And then if there is a pharmacy that that they typically go to, you can also select that pharmacy too. This right here, this means they're an active patient. If at some point they decide to move, you can go in and uncheck this active so that your reports, your patient reports are more accurate too. Now this preferred hygienist as well, if you have multiple hygienists and they prefer a certain one, I would go ahead and select it here. And then the recall frequency, I always like my clinical staff or my hygienist to come in here and just make sure this is accurate. If for some reason this gets changed to, a 3-month recall, we want our reports. We want our recall wizard to pull the accurate information. So if it's still at 6, we're not going to get that accurate information, and we could miss a recall in there if they hadn't scheduled. Receive recalls. So why would we not want this checked? Maybe this is a patient who came in on emergency. They don't live here, right? They probably won't be back. We don't want to send recalls to that particular patient, okay? And then here at the bottom, you have a summary of information. So year-to-date charges, collections, and visits. The date they were first entered into the system, and then once they complete their first visit, this will populate here. So again, this preferences screen is a lot of great information. So let's go back to that employer real quick. And in the employer preferences. So we always recommend moving forward to identify that policyholder by policyholder member ID. There's very few that will use the social number anymore. And if they do, that's okay. It'll still populate within this field here. So that's our recommendation. This is also, the calculation method for that employer. So, you're estimating insurance, you're authorizing the payment to the office. So just make sure you're checking, all of these correctly when you do enter in that employer. And then we always do bill the standard fee on the insurance. Now, just because we're showing and we're billing that standard fee doesn't mean that's what we're getting. But if all the offices, in that region bill their standard fee, it's more likely that you may get an increase in that fee schedule in the future. So we always bill the standard fee. However, it's the contracted amount that gets paid. Okay, moving on. History. So obviously this is a new patient. It's not going to show anything, but let me go ahead in here to an existing patient. And I'll show you. This history is going to show you everything you ever completed for this patient. So it's a nice, instead of having to search through the ledger, you can just click on that. You can also run a report for it. Alerts. This is where you will attach any patient alerts to. So like I mentioned before, that pre-med will not populate a pop-up window. So patient alerts will do that. So if you do want a pop-up window, you could come in here and we could find, I know we have a pre-med in here. Maybe we don't. Okay, that's fine. I can show you how to create an alert. So to create a new patient alert, and let's go here. So under list, we're going to go down to the bottom to general setup. You'll scroll over here to the right, and down here we have 3 types of alerts. We have the patient alerts, medical history alerts, and account alerts. So the account alerts are, for the account. Medical history are going to be populated from the medical history within Eaglesoft. And your patient alerts can be anything. So these are alerts that you can use, customize, create. Some offices have a very long list of alerts. So, don't lean patient all the way back in chair, right? Has electric toothbrush. So, there's all kinds of alerts you can put in here, but let's, for the sake of what we're talking about, let's create one for pre-med because we do want to pop up. So we enter the description. I'll type in pre-med. This box here, warn user when encountered, that's what's going to give you the pop-up. You can also set an indicator. Now, if you're not checking that pre-med box in the preferences, you could come in here, find your indicator, right? So there's a pill here, and you can just double click it, and you can have this pill here. If you are checking that box in the preferences, it's already going to put that pill on the schedule, so you might not want to double, you'll have 2 pills on the schedule. So if you're not checking the box, go ahead and select a pill, and then you could here use indicator on appointments and the virtual screen. And now from that point on, you'll see that show up on the schedule. So we'll just hit OK and then close. And now I'm going to go back into Michael. And to attach an alert, I'll click Alerts. I'll scroll and find my pre-med. There it is. And then I click Add. If I want to remove it, I just highlight it and click Remove. And then you simply just click the X there. This memo is also a great feature. So the memo is designed for those little tidbits of personal information we usually like to document in the chart notes. So instead of putting this in a clinical, legal document that the patient has access to, we can make little notes in here. Patient getting married in December, right? Or, patient graduating from college. You do want to date it and initial it because it doesn't do that for you. And once you delete it, it is gone from the system. So, probably one of the only things in Eaglesoft that is actually gone once it's deleted. So again, whatever you want to write in here that does not have to be clinically documented, maybe patient is grumpy, just, VIP patient, right? Very important patient. So you can write things in here as well. So, once you write something in here, now we can see that we have this little notepad. So it shows us that there is a note in here. So if I click it and remove it, it goes back to just saying memo. Prompts. So these prompts, you can actually create questions to add to the registration. So if there are some questions you would like to know that aren't on the registration, you can create some, and that would be under list and prompts. So I'll show you. I know there's some information, sometimes offices want to know, who, here, let's go down to list and then general setup. Some offices want to know who their last dentist was or emergency contact, right? So if we come over here, customizable prompts, we have patient prompts. I think up to 7 can display on that registration. So you can go ahead and type in some offices, preferred Profi paste flavor. These are just random ones I've heard over the years. So that's where you would enter them. And then you could actually see them on the registration. So let's take a look at that. And I'll show you where it shows up. So the section 3 here on the registration is where you're going to see those prompts. All right. You can send letters from Eaglesoft. So if you click on letter here, you can select your letter. Depends on, how many letters you have within the office or within the system. You can select your letter. There are certain letters that have, in SmartDoc, you can attach images. So there's certain letters that you can't do from, this area here if you want to attach images, but some basic letters you can. And you can, if those letters have merge fields in them, when you pull it from that patient's account, it'll go ahead and fill in those merge fields. So pretty cool. FAQ, I'll give you a couple FAQ numbers for letters. So number 43, and then the one for the SmartDoc would be 19962. Okay, so this missing tooth field, this is really just for offices that aren't utilizing the charting module. Because, if they're utilizing the charting module, the missing teeth are already going to be marked in that. So this would be for offices who aren't using that. And for insurance purposes, you would mark in your missing teeth. So let's talk about referrals. So you can actually document in that patient's chart how they were referred into you. So who sent them to your office? Were they not referred? Were they referred by another patient? And if they were referred by another patient, you can come in here and select who that patient is. So we'll just say Betsy referred Michael. You can also, well, let's move on. You can also be referred by another provider within the office. So if somebody who, works there referred the patient to you, or of course, another referral source, which could be another doctor, a specialist, maybe Google or Yelp. So if we're documenting here who referred this patient in, but it's not in our list yet, here's our hyperlink. We can come and click on this. And let's just say Yelp. Yelp isn't in here. I'm going to click New. And under Practice, we have to write Yelp here. And obviously, we don't really need a name and address for Yelp. And Yelp would be a source. So you have your sources. Those are who refer people to you. Recipients are who you're referring out to, so other specialists. And then they can be both. So, maybe there's a specialist that you refer to and they refer back to you as well. But Yelp is just going to be a source. We can hit OK, and then we can hit Use. So you can run referral reports in your reports to see where, all your patients are coming from. And then you can reward, your patients that are referring, a lot of people to you. So it's a really cool thing to keep track of. If you want to just go in and enter in all your referral sources, if they're not already in there, you could go to List and Referrals. And from this point, you have your sources. And then you also have, so you can enter in other sources here. And then you also have your recipients. So any doctors or specialists, maybe you're referring out to sleep specialists. So you could hit New and enter in that information there. And I do have an FAQ for you for that one too, of course. That would be number 160. Okay, so you can print, label and, or an envelope with the patient address on there if you wanted to do that. Your RX history, so anything you've prescribed to that patient in the past. Let's see, I think Charles Abbott probably has a prescription history. Yep, so if you click on that, it's going to show you anything you've ever, prescribed to them and when. You can also refill from there, create a new prescription from there as well. Yeah, I forgot. It likes to not like when I do that there. So I'm probably going to have to, I don't think that's going to work. All right, I'm just going to have to get back into Eaglesoft here, guys. Sorry about that. Sometimes you find a little glitch that you didn't know was there, and it didn't like that. All right. All right, let's go back. We'll just go back to Charles Abbott. All right, so that's your RX history, prescription history. You also have medical history here. If you click on that, you can view their medical history. Now, again, if you're using Revenue Well Forms or Upper DDS and they fill that out before coming into the office, this will automatically be synced. So that'll be done. You can go down to the bottom. If they have filled out other histories in the past, you can review those as well. Okay. You can print a form and that'll have their name in there. You can print a blank form, which will just be blank, or you can print answers. So it'll print it as it is. So if you're still using paper, you can print that out. If you want the patient to review it and make any changes, you can certainly do that. You can also customize medical history forms. If you wanted to remove some questions or add some questions, you could do that. And you would do that from list and, of course, list. Everything's in list. You would do that for general, well, sorry. It's actually right here, medical history forms. So you could do that from there. And I have an FAQ as well for customizing medical history forms, and that would be 18680. All right. The account is just simply going to take you to that patient's account. Real-time eligibility here. So if your office has subscribed to eligibility, you can click on that and you could get a summary of, the insurance benefits from that link. So I am not actually hooked up or signed up for that. But it is real time. So, patient walks in the door, you can click on eligibility because who knows if they went somewhere last week and had a tooth pulled and, haven't told you. So you'll be able to see those remaining benefits real time. Your smart doc here. So this will take you to that patient's electronic filing cabinet or electronic chart. And you can see anything that's been scanned in or saved into the smart doc. You also have document groups here. So you can view documents by group. And then letters too. So any letters that have been created into SmartDoc, you could do that as well. So again, like I mentioned before, you can actually create letters in SmartDoc and attach images to it, which is pretty nice. So let's just say that's how you would do that. And then you could right click. Oh, you would actually do it from the merge. And then you would do that. So I gave you that FAQ number. Oh, geez, it is not liking what I'm doing. I gave you that FAQ number so you can go in there and create, I know sometimes we like to send before and after images or photos or what have you. Sorry about this, guys. And we'll go again. So sorry about that, you guys. Oh my gosh. Can you hear me, Rosie? That is embarrassing. Thank you. I am so sorry. The beauty of figuring out this virtual stuff here. All right. So let's go back in here. We left off with SmartDoc. And that's honestly really about it for that new patient entry, policyholder and responsible party entry. We talked about how to enter in referrals and track that. We're going to move on here and talk about exploding codes. So, exploding codes. What is an exploding code? An exploding code actually is a code, one code that represents a group of service codes that are commonly used together. So it makes your scheduling, your charting, your treatment planning, your walkouts just a lot more efficient. So there's definitely opportunity to create, several exploding codes. You may already have some in your software. When I create an exploding code, I go under lists and then down to exploding codes. I like to put a period in front because that brings that code to the top of the service code list. So I already have quite a few here in my software, but I'm going to create a couple to show you how it's done. Your FAQ number for that is going to be 336. And you want to give it a name. So again, well, you have 5 characters. I always start with the period. And let's just say we're going to create one for an extraction. And for that, I'm going to include an extraction and also bone graft. And for my display abbreviation, I'll just keep it the same, extraction. And then the button group. We'll talk about the button group, but you can put this in your charting module within the button groups that are on the side. So if they are going to treatment plan they have easy access to that. So there is an extraction button, and I'll go ahead and just select it there. Now we want to go ahead and add our service codes. So if I click add, I can either hit F2 and it'll take me to that service code list, or I can just type in the service code here. So we'll type in 7210. Oh, it starts with D. Great, that's the extraction. And then I'll add the alveoplasty there. So we have the 2 codes that we typically would treatment plan for this procedure. So we'll hit OK. So now we can see here we have our extraction exploding code. Now I'll create another one here for maybe, wisdom teeth extraction. So if I go ahead and put extraction, I'll do all caps since all the other ones are, and then the number 4 so that we know we're extracting the 4 teeth. I'll put in maybe 3rd molar extractions. And our display abbreviation again. And then we'll do a button group. And I'll just do that under the extraction button group again. And now I'll click add. So basically we're just going to add in the extraction code 4 times. Gotta put the D in the front though. And then I'll show you how this works as well. Oops, that took me to the, if you hit F2, like I said before, that takes you right to that service code list if you need to go there. Okay, so I don't know that we necessarily need to do bone grafts for wisdom teeth extraction, so I'm just going to leave it as is and hit OK. So that's how you would go in and make an exploding code. And then the way we could use it, a couple different ways here. We could use it in the schedule. So if we're actually going to schedule a patient, let's just find any open spot here. Let's say we want to schedule, yeah, we're not really going to, we're going to next week here. And say we want to schedule someone at 8 a.m. for Dr. Young to do an extraction. I'll go ahead and use Michael here. I'll change my appointment type to oral surgery. And then when I come down here to add service, so if it hasn't been proposed yet and it's not in the treatment, I can hit add service, and I'm going to come over here and just select that. So I'll double click on it. Now it's going to bring all 4 of those codes in. Of course, I have to select a tooth, right? But it really cuts down on time, really makes it a lot more efficient. So now we have in all the wisdom teeth to be extracted, and I hit save, and there we go. So we did assign him to a pre-med prescription, so that's why we're getting our alert here. So we could choose to prescribe it, assign a task to remind us from the task manager, or just don't prescribe at this point. So that's a way we can use the exploding code. We can also use it if you're just creating, a treatment plan. Same thing. So I'll come in here to treatment plan, and I'll create one here. I'll just call it third molars. And it's none of the above, so I'll X that out. And when I go to the service code list, I can pull that in right here. So again, it pulls them all in. I just need to enter in the teeth. So now we've created a treatment plan for that. We can also do it in the chart. So say for Janice, we're in her chart, and I'll show you the button groups over here. So we have the button group for extraction. If I want to propose to get all of those wisdom teeth extracted in just one click, I would come here to the drop down, highlight it. It's going to go through each tooth. So since I didn't highlight the teeth, I do have to select them. And hit OK. And now I have all of my wisdom teeth proposed to be extracted. So that's how exploding codes can be super useful. And honestly, I don't know a lot of people that know all of their codes. So if they can click and go to that service code list and find it like right at the top, they are very happy. Some offices will even, if it's even just for one procedure, they'll create an exploding code just for that one procedure, just so they can put it at the top of the list so they don't have to go searching for it. So that's the benefit of those. And I think they're fantastic. So I think I may have given you that FAQ number. If I didn't, it is 336. All right. So moving on here, we are going to talk about walkout processing. So that's going to go ahead and be FAQ number 11917. And we're going to talk about this. There's, of course, a couple different ways we can do walkouts. We do have the ability, to do it right from the schedule and hit the walkout here. We also have the ability right from the appointment to come over here and click this fast walkout. There's also a fast walkout in the chart. However, I do not recommend that your office uses this. The way we recommend it, just to avoid as many errors as possible, is to actually go in from the account And then down at the bottom, go to the walkout from here. So once you click on that walkout, you'll get the treatment plan list or the proposed services populated here. So at that point, you can select the services that were done. Now, in the ideal practice and the way I like to have things done, I like for the back to do their part and post to Walkout exactly what it is they did. Because we know, even though, let's say Richie Ballard here is scheduled for a bite wing, 4 bite wings, a prophy, and an exam, that may or may not happen. We may not do the bite wings. Maybe we do a full mouth series. So in order for the communication to just be really smooth, I like for the back to go into their chart and just post to Walkout what they did. So if we right click, and they can select all the surfaces they did, and we see this double @ sign here. This double @ means that these are the services that are attached actually to this appointment. So that's what they're scheduled for today. So if they shift and select all of those, they can right click and they can hit post to Walkout. And then once they hit save, the patient comes up front, you go to their account, come down here to Walkout. You're going to get that same window populate. However, we notice these check marks here. So the check marks represent what they posted to Walkout. So basically they're telling us, yes, this is what I did, this is what I did, this is what I did. Now you can hit use selected plan services on the bottom and it pulls all of those into the Walkout. From that point, you'll be able to see, your standard fee, any adjustment made by, the fee schedule that may be attached, the fee resulting from that and what insurance is covering. And then over here, you're going to go ahead and see that patient portion. So you'll be able to see what the patient owes. You can also see what they owe here with this Walkout. Okay. Total due is the total due for the account. So when we look up here, everyone who's in the account, you can actually see the individual balances there. But this is what's due for today, this Walkout. So if we're going to take that patient portion for today, you're going to go ahead and you're going to take that payment from this little add payment button here. So what that's going to do, it's going to apply that money to today's services. So if there's a discount you need to do, an adjustment for this particular Walkout, you would go ahead and do it from here. But if we wanted to add the payment from here, you would click add payment. And let's just say we're going to take that $40.60. And then we're going to go ahead and apply it. I'll hit save. Are you ready? Yes, I'm ready to process it. Now what you get, if there's a lot of unpaid transactions in that account, you're going to see a big list here. But any unpaid transactions are going to be listed, but it's taking your money that you just put in and it's applying it to today's services first. And you can see up here, it's checkmarked to automatically distribute the money to that to those Walkout services first. So that really helps to put the money where it goes and to avoid any confusion in the account. If for some reason you were to take it to the account payment instead of from add payment, what it's going to do, it's going to apply that money to the oldest non-insurance balance first. So let me just cancel that. And I'll go and I'll pretend like I'm taking it from here, which I'm actually going to go into the account here. Well, we'll go ahead Actually, let's save this one and we'll do that for a different patient. So I'm going to go ahead and hit save and apply. And then we're going to go ahead, here's our claim, submit our claim. Okay, I'm not sure what is happening with that. Okay, so the nice thing is too, when you go to the account, you see the services in blue is the claim that's open that we just submitted. And then we have a check number here. So we can right click and we can view the distribution. And down here at the bottom, it's showing us the payment was $40.60 and it's showing us exactly what that went to. If for some reason that is incorrect and it shouldn't have gone there, let's just say hypothetically, I mean, at this point it's correct, but hypothetically, if it wasn't, you could right click and remove that debit item from that service. So now we see that we have an unassigned amount of $25 and there was no actual payment for that exam of the patient's portion. So you could unassign it. At that point, you're going to see in your ledger, you have this question mark with this $sign. And basically that means there's an unassigned credit in that payment. So if you double click on it, it's going to go ahead and bring up all your unpaid transactions. And it wants to apply that to the oldest non-insurance balance first. We don't want it to go there. We want it to go to that pro fee. So I'm going to highlight that, zero it out. And I'll go ahead and put that $25 back to that pro fee and hit save. So now when I right click and view the distribution, we're back. Okay. So let's go to Joshua here. And let's just say that he is scheduled for Profi, Bite Wings, and exam. Okay. We'll say that the back did not post to Walkout. We'll just say they didn't post to Walkout. Or maybe they did. Maybe they did post to Walkout, but they forgot to remove the Bite Wings. Let's just say he didn't do the Bite Wings, but they posted to Walkout what they did, right? So they posted the exam and the Profi. Patient refused Bite Wings. They didn't remove it from the appointment. So let's just hit save. If you were to go into Joshua right now and just click Walkout, it's going to bring in all the services that were tied to that appointment, even though they didn't post the Bite Wings to Walkout. So that's where it can get a little bit tricky. That's why I always say, truly, go in from the account and then go to the Walkout button. And therefore, you're going to get that list, and whatever they did is going to be check marked. Now, we didn't post the Bite Wings, so we're not going to do that. So that's the confusion that happens, and I see it happen a lot. So that's why I recommend, because we all have good intentions and we all, want to post the right thing, but we know we get in a hurry and we're rushed and we're trying to get everything done in the time period we have, and sometimes we make mistakes. So that's the difference there. I hope that makes sense to everybody. I hope you guys also are creating codes, just service codes for things that you're not charging for. So, if someone's coming in just for a post-op, hopefully you're having, you're posting a service code for just a post-op and walking that out, even though there may not be a fee for it. Or, let's just say an adjustment. a suture removal, impressions, or a try-in. It's nice to kind of have, what you did in the ledger, but also for the patient to actually see you did provide them a service and there is a value to that. Another way you can do a walkout too, some offices don't have services within that appointment. So let's just say we have someone scheduled for a cleaning, but we didn't tie the services to the appointment, which I highly recommend that every office does, but some offices don't do that. Even though we see here that planned services do exist, you want to select them. So I always say when you do schedule an appointment to say yes and look at that, because you might indeed be wanting to schedule a service that's, already listed in the proposed. But let's just say for some reason, we didn't have anything proposed and we didn't schedule it. They don't know what they're going to do until they get in there and do it. So we'll say we're old school. It's time for Mark Abbott to leave. They bring you up a routing slip and they wrote on there exactly what they did. So now you have to go in there to the walkout and enter it. So I'll click walkout. Now, of course, this is going to populate, but we'll pretend it's not. You could come here and add the service, right? You can hit F2. You can go to that service code list. If it's an exploding code, say they did a prophy exam and bite wings, you could just select that and bring that into the walkout that way. Or of course, if it is something that was proposed, but you're not entering in the appointment and they're not posting anything to walk out, you can still go in to the proposed and select it from there too and bring it in. But like I said, in the ideal situation, we really want all of our services to be within that appointment, and we want our back office, to be right-clicking and posting to walkout exactly what they did so that we know when we go into the account and into the walkout, those services are checked. We can also edit a service in the walkout. So if we come into account here and hit walkout, and let's just say we're just doing number 2. If for some reason we need to do any editing of that service, we highlight it and we can come down here to edit service. You have the ability, if you forget to walk out a crown from today and it's tomorrow, you can come in here and change the service date. You can also change the tooth number, if the tooth number was a mistake, and you can also change the fee or what insurance is estimating. So if you need to make any of those changes, you could do it there. If for some reason this was a redo of a crown that was done a month ago and you're not going to resubmit that to insurance, you can uncheck that, submit to insurance. You can also create a lab slip on the fly or create a post-op call too. So, that edit service screen, you can do a lot within that. Okay. The show estimation is a great button too. So if the patient is in front of you and they want to know exactly where those calculations are coming from, this is going to show you that. So it's telling you that, it's calculating the insurance for the crown, the starting fee, based on the employer benefits, the percentage to be utilized is 50%. Based on the employer benefits, the deductible does apply, and so on and so forth. So that's a nice feature as well. And you can even print this out for the patient. Okay, you can do family walkouts. So let's talk about family walkouts. Who do we have in here today? We have Charles and Janice that are both, they're family members, they're related. So Janice is here. She's doing her prophy and exam. We'll just say that they did their job in the back and they posted to Walkout. Okay. And then Charles is having a root canal, poor guy. And we'll go to chart here. And we'll post that to Walkout. And save. So now we'll go into Charles and we'll go to account. And then we'll go down here to Walkout. And that's from before. We'll go ahead and use selected plan services. And then what we'll do is we'll click on Janice here. And then her services are clicked. So then we'll use her services. So now we have Janice's services pulled in, and we also have Charles pulled in here. So you could certainly go in there, you know, if you have, I know a lot of times we have multiple kids of the same family coming in at the same time for the cleanings and all that. So you could go ahead and walk them out, you know, at the same exact time. The family walkout will be FAQ number 11919. And then more information on that edit service button will be number 172. So let's go back in here to Richie. Let's just say Richie mails in a payment. We can see his account has, you know, $390 due. His balance, so the balance would definitely be including the insurance estimation, but his due now would be 148. Oh, actually, Richie is 11. There's Richard and Richie in there. Let's just say we get a check for the account in the mail. So we're going to come down to account payment. And we'll just say that he wants to pay off, you know, $200 towards his balance. We can see it's defaulted to go to the oldest non-insurance balance first. So as long as this distribute button is selected, you can choose to either put that payment towards a service, towards that particular patient, or just towards the provider that the money is due to. I like the line item because you can put it right to the service where it's supposed to go. Let's just say he's making a $200 payment and it's going to go towards that root canal that was done. We can see when we enter the amount in there, it's trying to disperse it to the oldest balances first. But truly, we want to pay off that root canal. So we can come in here, highlight, and zero out where it's trying to put the money. And we can go ahead and put it exactly where it needs to go. So I'm going to put it on that line item for that root canal. And then I'll hit save. So that's how you do the line item accounting. You know, I know sometimes, again, when there's a couple, you know, on the same account, you know, you want to make sure payments go to where they need to go correctly. Some couples are, you know, some people are really particular about paying their own services, right? So if the husband and wife both have a balance and, you know, the wife wants to make a payment, she wants to make sure it goes towards her service and not his. So that's where that line item really comes in, and it's really beneficial to be able to do that. How's everybody doing? Do you need a little break? Maybe a 5 or 10-minute break? Just let me know if you do. Otherwise, I'll keep going. Okay, Rosie, let's do it. Let's meet back here at 11. It's about 10:48 right now, so we'll take about, you know, 12-minute break. We'll meet right back at 11. All right, so we'll move on here in this last hour. We're going to go ahead and focus on the schedule. So we can access the schedule simply from our picture there. And within the schedule, so there are two different toolbars. We have the activity schedule, and then you have the on schedule toolbar. Sorry, activity toolbar and the on schedule toolbar. And these are customizable per workstation as well. So you can add or remove icons as needed, and that's pretty simple. So if you just right click anywhere up in the toolbar, there's a couple different things. So you have your option of hiding, your on schedule. If you right click, you can select it again or vice versa. You can also either show the text or not show the text. I prefer to see it. It definitely makes things bigger, and those icons are so small, I just cannot see what they are. If you wanted to add or remove icons, you can go to this Customize here. And depending on which toolbar you're on, you can drag and drop. So once this is open, and let's just say, we don't want the schedule notes on there. We can simply grab it. We can hold our left click down and just drag it and drop it into this little window here. So if I want it back up there, I can go ahead and grab it and drag it as well. If I want to move it to a different location, as long as this window's open, I can grab it. And wherever that black bar is, if I release it, that's where it will drop it to. Now, one other thing we can do is if this window is open, if you right click, you can rename what it says, because so this calendar here on your workstation, it more than likely says go to. I changed mine to say calendar. So if I click in there, I can always change it back to the go to. And that's what it says. I really prefer for it to be calendar. So you can certainly go in there and rename these if you'd like. You just have to make sure this window's open, and you just do that, by right clicking anywhere up here, hitting customize, right click, customize, and then if you right click, you can rename what your icon is. So again, this is going to be per workstation. Couple things here I want to review as well. If we go back into our practice management screen and we go into this file preferences, if we click this on schedule tab, so anything you see with an asterisk here means it's workstation specific. So if you want your font size to be the largest for your workstation, you can go ahead and switch it in there, right? So per workstation, you can increase or decrease that font size. We also have appointment cards that you can actually print. If you click on them, you can hit preview and it'll just show you what that particular one would look like. You do need that, I believe it's the Dynamo printer. And then you could, buy the perforated sheets and print those off too if you want for the patient. And you can also change the message here for the appointment card if you wanted to do that. Also under this general tab, you can have your workstation. So when you go to search for a service code, and I'll just show you this, it automatically populates to have, let's just double click in here. Whatever you have that set on for your workstation. So since mine was on service code, that's what's going to be selected. But if I wanted to select description, maybe I prefer to search by description, it'll default that particular workstation to search by description. So again, that is workstation specific. I understand not everybody knows their codes, so you could go in there and change it. We also have this smart codes. So using smart codes in the walkout and in the treatment plan. So Eaglesoft does have some of your service codes set up as smart codes. So any service code that would require a surface, so like a composite, posterior composite, 1 surface, 2 surface, 3 surface, they're set up so that you don't necessarily have to select, how many surfaces it is. It will automatically change it to the corresponding surface depending upon which surfaces you actually select in the chart or in the treatment plan. So that's what a smart code is. So I always have these checked too. All right, we'll go back here. When we look on this schedule, I am actually viewing this schedule by appointment types. So the A/P, you can toggle back and forth between viewing by appointment type, which if I double click on this, I'll see my appointment type here is yellow. So our crown and bridge here is a yellow appointment type. So we can kind of just glance at that schedule and know kind of what's going on today. So I can view it by appointment type. I can also view by provider color. So this is kind of a good thing to glance at, when you come in for the day. You check your column. So if you're hygiene or doctor, you check your column and make sure everything's in your color. So hygiene Diane, she's pink. So we know that those services are properly assigned to her. Now, when I look down here, there's yellow in her column. Well, yellow is Deborah's color. So I know I need to come in here and I need to change it, back to Diane so that she gets credit for the services. So it is kind of nice to be able to double check that. You can also see, Dr. Young is green. So he's going to be over here in these hygiene chairs, like the last 5 minutes, to do those hygiene checks. So you can toggle back and forth between that. And those appointment types are set up under list and then that on schedule tab and then appointment types. So you can see within the appointment types, the color is chosen. It's normally performed by, dentist or hygienist, dentist. And then the typical amount of time we need for that procedure, it will default that appointment to 40 minutes. You can always increase or decrease that time in the schedule on the fly. And then the time units are marked. This is when the dentist is going to be in there. And maybe the last 10, 20 minutes or so, the assistant will be fabricating the temp or what have you. So that's how those are set up. If we look at a hygiene one, we look and we see we have green, normally performed by a hygienist. And that's, important to have checked because when you do go and switch that appointment type on your appointment, it's going to default it to the hygienist instead of having to change it every time from the dentist. So that's why we like to go ahead and select who it's performed by. 60-minute duration. Hygienist is taking up all those units except for maybe the last 5 minutes. And that's how we saw that Dr. Young's color in there towards the end of that appointment. Now, again, in lists under on schedule, you also have the ability to name your office chairs, right? So we have assigned our providers to certain chairs and we can have those chairs named accordingly. So when we look at our schedule, we see Dr. Young, he's assigned to his chair and so on and so forth. Some offices call it just op 1, op 2, what have you, hygiene, doctor. You can name them, whatever best fits your needs. You also have the ability to design templates. So what does your, ideal Monday, Wednesday, Friday, Dr. Morgan, his ideal schedule for that day? He wants to do all crown bridge preps the beginning of the morning. He then would like to, schedule oral surgery. There's some time for emergency in there. This is going to be his lunch break, afternoon. He kind of wants to take it a little easier. So you can design your own templates for each day, each provider. And when you look on the schedule, what you'll see, if we go to Monday, we see the colors over here. And this is because we have some templates assigned to this particular doctor, chair, and day. And we see that yellow is our crown color. So this is ideally what we want to put in this time frame. It doesn't mean we can't schedule something else there. We can schedule, any kind of appointment we want there. But it's just kind of a guide so that whomever is scheduling really kind of knows what the doctor wants during that time. You can also create goals for the day. When you look up at your schedule, let's go back to today. When you look at the top of your schedule here, we have two numbers. The right side is the goal for that particular day. The left side is going to be the sum of everything scheduled within these appointments for today. So you can take a glance at that schedule and really see, where you stand as far as production goes for that day. Now, where does this $6,000 come from? That's going to come from the provider setup. So within each provider, when you go into the hours and you select their name, this is where you can put their goal for that particular day. So if we want him $2,000, every day, that's where we're going to put that information. So the sum of everybody working on that particular day, as long as they have their goals in there, is going to actually show up right here. And then you also have this goals icon. If you click this, it's going to break it down individually, and we'll see, Deborah is scheduled for $724, but she doesn't have her goal set for that day. So you can kind of see, let's go in here to George Young. And let's take a look here. And we'll go back to, let's see here, Diane, and see if she has goals. So she has some goals in there too. So that's where that tally is coming from. That's $6,000. And for provider goals, that FAQ number would be 6375. So let's talk about these icons up here on the top of the schedule. We have the day at a glance, which is basically what you're looking at here is your day. Your week at a glance, it's going to break down the week. So you'll see that nobody worked on Monday. It was a holiday. This is today, so it breaks it down by the 4 chairs we have. We can see what's scheduled and where our openings are. Our month at a glance is a pretty cool view because it breaks it down day by day. And you'll actually be able to see, if we look at today, we have 26 appointments scheduled for today. The amount we have scheduled, our goal, the percent to goal we are at, right? So you have all that information there. We are in green here because we are exceeding our goal. So anything in red means we haven't quite met our goal for that day yet. If we look down at the bottom, we could see our monthly totals. And we can also see how many new patients are scheduled. So if you click this link, it'll show you exactly who is scheduled. And then this right-hand side is the selected range. So if we're clicked on today, we'll see all the information relative to today. So I like that month at a glance. It's something cool to look at. Not saying it's going to be completely accurate because we know, patients do cancel their appointments and things do change, but it is a good little just kind of summary to check out. We talked about the AP. We have this edit and confirm. So there are, as we know, several different ways to do the same thing in Eaglesoft. So you can right click as well, and you can edit the appointment. You can also confirm the appointment by right clicking. So you can either highlight and select up here, okay? Or you can right click. You can also just double click as well. So there's, several different ways you can edit an appointment. Delete, copy, move, we'll go over those as well. But first we'll talk about this icon here. Create family appointment is what it says. Now there is this little drop down arrow, so you can access more functions by clicking on that. So you can actually just create an appointment from here, create a block, create a quick fill appointment, family appointment, or an unscheduled appointment. And we'll talk about those. But depending on what you used last is what's going to show as the icon. Okay, so if you're looking for that, create family appointment icon up here and you can't see it, well, it's because you used the block last. So you can certainly create a family appointment, and the way to do that would be to click on that icon, select your family name. Now it's going to bring up your list, and then you get everyone in that family. So you're going to want to check mark everyone you want to schedule. And then you can pick what the appointment's going to be for. So we know a lot of times, like I said before, we get those families that have 3 kids and they come in, next to each other or one right after another for prophies. So you can pick the appointment, the duration, and then you can hit save. And what it will do is we look at our good old appointment queue over here. Under family appointments, we see all their names. So if we want to say schedule them for next week, we can click up there to next week, come to our appointment queue. Now I'm going to pin this so it docks to my schedule so I don't have to keep hovering. Then I can grab each individual one and move them into the corresponding time that I want to schedule them for. All right, so that's how you would do a family appointment. Now, if I don't want this appointment queue open all the time, I can just click that button there and it'll stay over on that side. But I'll talk more about that appointment queue shortly, but that's how you would schedule a family appointment. And if I click on any open area in the schedule, I can create a block. So let's just say we need to block that last hour of the day. There's a couple different ways we can do it. We can either highlight, or double click on the time and then come in here and hit block. And then we could type in out of office. And we can change the duration. Hit save, right? Or we can just select the time, come up here, select block. Okay, however you want to do it. So you can block off that hour and it can't be scheduled over. So that's how you would do a block in your schedule. Okay. Create appointment. Basically, you can select a spot on your schedule, hit create appointment, or you could just find the spot or the time and then double click and create your appointment from there. Now you can also create an unscheduled appointment. So that's an appointment that isn't scheduled, basically. So you would put that appointment in the queue. So if we know that, say Chad's going to need to come back for a filling, but he needs to go home and he needs to look at his schedule or he needs to talk to his boss, we can go ahead and create an unscheduled appointment, right? And then we could put him in the schedule for exactly what he needs because we know we could put him in the queue actually. We know he's going to call us back. He's a very good patient. So we'll go ahead and we'll select restorative. And we'll just say he doesn't have anything proposed, but he needs a filling. Okay. Now, when we look over in our queue under unscheduled appointments, we see him over here. So when he calls back later today or tomorrow, we can simply find, the day and time he wants to come in. So let's just say he wants to come in October 1st. I could grab him from the queue and slide him right into the schedule. Right. Or we could have put him in the quick fill list as well. So if we think maybe he's not going to call back in a couple days, it might be, in a few weeks, we could schedule a quick fill appointment. And that way it's not bogging down our queue. And we will have that appointment still like in our call list, in our queue. So that's what the quick fill is. It's kind of like your short call list. Some software call it a tickler, so if we look in there, we can see he's in there for restorative. And then you could even put a note in there if you want, patient will call back or call him October 1st to schedule. But we'll go over that quick fill a little more in depth shortly here. So if you need to move an appointment, you can either select it and hit move. Now, if you're moving it and you're on the same day, you can just kind of drag it and drop it. But if you're moving it to a different day, you could either right click and hit move, select it once and click move, or I'm just going to pin our queue open again. I'm a dragger and a dropper. You could just left click, drag it and drop it right over here where it says move. Go to the day you want to move it to, drag it and drop it back over. So if you do it by a right click, it's going to do the same thing. It's just putting it in the queue. Same thing. If you highlight it and click move, same thing. Just it all puts it in the queue. It's just a different method of getting it there. So you see with your queue, you have moved appointments, family appointments, unscheduled appointments. You can also copy appointments. So if someone's coming in, in 6 months for a cleaning, it's the same appointment. You can copy it. And we can go to, well, let's just say 6 months. And then you can select it. You can even drag it and drop it or right click and paste it, right? So if you do ortho and they have multiple ortho check appointments you need to schedule, just copy them. It's just easier that way. We'll go back to today. So up here you have your arrows. This is going to take you 7 days in the past, 1 day in the past. You have today, 1 day forward, 1 week forward. And here's your calendar. So you can dock these to the side. So if you click on calendar, just make sure this pin is pushed and it's going to stay there. If you click the pin and it's sideways, once you hover away, that calendar just kind of goes over and you have to hover over it to see it. I like to pin it. Same thing with the queue. I like to have my queue, even if it's just kind of hovered over in the sideline. Your locate is a great feature. So if you have a patient call up and say, you know, they have an appointment, they just can't remember when. It's going to show you current appointments for anyone in the account and then all the past appointments as well. So you can tell them, you know, when they were here last. You can view the appointment. So if you want to see what's, you know, scheduled within that appointment, you can view that. If there's anything scheduled. You can also go to the appointment, delete it from here, and then you also get this tally down here too. So I love that locate button. Here's your quick fill. So one thing about quick fill that I really wanted to point out, if someone calls to cancel their appointment, we'll say Dale can't make it. Say you got there's a sudden death in his family, unfortunately. So if we right click, we can delete it, or we can highlight it and hit delete up here. So I'm going to click delete, and what you're going to get is this window here. You're going to have the option to pick for that tally if they failed. So if they didn't give you any notice, if they canceled, so, you know, if you think they gave you reasonable notice, or neither, which would more than likely be, you know, a cancellation due to no fault of their own. Maybe you guys had to cancel because of a CE seminar or a pandemic, you know. You can create an account note, which will just say, you know, deleted appointment. If you want to apply a cancellation fee, you can do that as well. It's going to default this to go into the quick fill, which is fine. But if it's an appointment that you know that patient is not going to reschedule anytime soon, I probably wouldn't add it, because the quick fill lists tend to get bogged down in practices. And when it gets bogged down, it loses its value. So in this, you can put a note, you know, sudden death. And then you can click this to add that note into the account. Once you hit OK, it takes that appointment off the schedule and it puts it up into that quick fill list. And then when you look through, you can see here he is. Here's the note, sudden death. So, you know, if you have someone going through the quick fill list, maybe weekly, trying to schedule patients from here or fill a last minute opening, you might want to wait a couple weeks before you call this patient. Just give them some time to grieve. But within this quick fill list, you also have the ability to narrow it down. So if you're just trying to fill some prophy appointments, you can narrow it down by appointment type. So you can click here and just filter all your prophies. You can also filter that patients on short notice, like we talked about in that patient preferences screen. So you can filter from the, you know, date from and to. So once we hit apply, we get all our prophy appointments. So the quick fill list is really great, you know, if you're trying to get your schedule back up and running or fill in last minute openings too. Okay. Schedule notes. So a lot of people will use blocks to kind of communicate, you know, lunch and learn Friday or lunch and learn today from Patterson. You don't have to put blocks on the schedule. You can use these schedule notes if you'd like. So the icon up here is like a blank notepad. You can dock it as well. And then once somebody writes a note for that day, they hit save. We see now there's like a pencil and there's some scribbles on that. So we know there's a schedule note. You can always hide that. So it just kind of hangs out on the side. And once you hover, you can see it. So you can use those schedule notes. I think they're pretty useful, and they're new notes for every single day. Okay. So you'll see when I go to tomorrow, there's no notes there. We talked about goals. We have the track arrival. So we have this stoplight looking thingamajig here, right? So once the patient arrives, if you right click on that appointment, you can hit set next arrival indicator and it turns it yellow so that everyone in the back knows their patient is here. Once they come up and get their patient, they can go ahead, click it, change it to green. So everyone knows that patient's in the chair. Now, some offices will use it differently. When the patient arrives, they'll click it to yellow, but maybe the patient's filling out paperwork or using the restroom, brushing their teeth. So they're not quite ready to go back yet. So once they are actually ready to go, then the front desk will, change it to the green. So however you guys would like to use that, but it is a pretty good communication tool from front to back. Once you hit this track arrival, you can see, who's been everyone on the schedule for today, if they were late or how long they've been waiting, how long in the chair. So you can also run a report from that if you guys are trying to keep track of your time. Views, you can set up different views. So if you have, a day that you have a bunch of different doctors and hygienists, and maybe you're a hygienist in the back and you just want to view the hygiene schedule. Like you can just do a hygiene view. You can also view, maybe it's just Dr. Morgan there that day with hygiene. Or front office. Front office likes to see everything. So you can do front office. And the way you would do these views is you would set up the schedule the way you want it. So if I just wanted to see the doctors, I would right click up here and hide this chair. And then I'd come up to views and I'd hit save as, and I would just call it doctor views or doctor's view. And then I'd hit OK. And then from this point, if I wanted to go view that front office view, I could do that. If I wanted to just see the doctor view, I could do that and just see the doctor. So you do have options. If you're a big practice, right, you may not want to see 12 columns across your screen. So you definitely have that ability. This setup, this is really what's going to determine what you see on your schedule and within the appointments. So we can see here, this is showing the text that is in the appointment. So we see the patient sex, male or female, which is going to be the F, first name, middle initial, last name, preferred name, appointment notes. So everything here is what's showing. If you come up here to field, if there's something else you want to see, so you do have the ability to put that chart ID in there. So, whatever you wanted to use it for. So if it was a preferred doctor or something, you could be able to view that. If you want to prefers AM or PM, short notice, appointment time. So maybe you just want to visually, see the time. You're going to go ahead and select it and then you'll hit insert. And then once you hit OK, now you'll see the time that appointment starts. And sometimes there's just not enough room to see everything, but you can see it. And then when you go also into the setup, you do have the ability to determine what icons are going to show. So if you don't necessarily need to see, if they're a sooner if possible, and you don't really need to see that, you can remove that icon. But every icon you have on here, if it pertains to that patient, will show up on the side. This is also talking about your goals. So to display the goal information, which we do have displayed up here. If you don't want the pop-up, so you know how you hover over this and you see this pop-up window, you see the pop-up, right? If that drives you crazy, you can always uncheck this. And that way, when you hover, you're not going to get that pop-up. Some people really like to see that though. So it's up to you. You can also show the time on the right as well, not just the left side of the schedule, and the service info. So that's going to give you your codes. Double book, triple book. So you'd be able to see on the side here, you see how it's yellow? It means this doctor is supposed to be in 2 different rooms at once. So he's probably doing a hygiene check over here, right? While he's in the middle of a crown. So, you have some options there as far as what your schedule looks like. You can, your print setup for your schedule. You can customize your month at a glance. So remember how the text was green and red? It was green if we were at 100% of our goal, and red if we were at 99% or less. You can change that criteria. You can also change your colors. So that setup is pretty neat. You can print your schedule, of course. You can also, you can get help from here. So this will take you right to your FAQ that we talked about before. And live help, same thing. There's so many ways to get help. And then of course, when we look down here, this is our activity bar. So, you have your various icons here pertaining to exactly what it says. So I know we talked about Intellicare briefly. So Intellicare is a way to customize alerts. So it's pretty cool. You guys see this? It's a little birthday cake. I know it's hard to see, but when I hover over it, it says birthday reminder. That's actually an Intellicare alert. So if I go to this practice management home screen, and if I go to lists in Intellicare, you can actually set up some alerts. It's going to query each account for whatever information you put in for that alert. So we have a birthday reminder, missing email. So if we look at that missing email, it's going to query everybody to see if they have email in that email field. So when you do go and set that up, you give it a description. This is missing email address. And that's going to be under, you'd select patient info and then email. And basically it's going to give you an alert for every patient that doesn't have an email address. You could then edit that patient record. So the action is edit the record. It will open the account for you and you can go right in there and enter that email. So we could do one account balance. So anyone who has an account balance, let's say. So I'll call it account balance. And this would be an account description here. So anyone maybe who has a 30-day or more account balance. And then what's the action going to be? I would say open the account so that we can ask them to pay for it. Where do we want that notification to pop up? I would say when we open the account, maybe even when we schedule an appointment. You can add an indicator here. So if we have a $sign, I'm going to add a $sign. And now I'm going to check these boxes so that we get the pop-up. And I'll hit OK. And now everyone who has an account balance, let's see, we got to X out of the schedule, go back in. And actually got to make sure. Okay, good. So we see these $signs here now on the schedule. So account balance. If I open him up, I will get a window here. It says account balance. I have this green arrow. If I click it, it's going to take me right into his account so I can take that payment. All right, account payment. Good. So now when I click back into him, that account or that window won't pop up again. So that's how you would do Intellicare. And you make sure in your setup that you have your Intellicare alerts. So let's put it over here. You make sure you highlight it and add it so that it shows up. So that's Intellicare. Did I give you the number? 9482 is going to be the number, your FAQ reference for that. All right, let's see here, 1 second. We have gone through, I think, just about everything here. Yeah. What's the code for that? For the Intellicare? Is that what you're referring to? Yeah, the 9482. So let's go back into that real quick. So we'll go back into this FAQ. Let's say 9482. If I type in that 9482, why is that not popping? There we go, search. Got to hit search. Intellicare setup and examples. So you'll be able to go through, it'll give you screenshots, how to set it up first and then how to create them. So it's a pretty great feature we have here. Also, in this picture frame, you have this live help. So if you're on support, if your office is on support, you can live chat this anytime. This is going to be the PTC, otherwise known as the Patterson Technology Center. And this is our support center down in Effingham. It's huge. And there are a couple hundred support specialists there to, chat with you, to take your call. So if you have any questions, I always say try the FAQ first. If you can't get your answer, do that live chat because they usually get on pretty quick with that. If you just need to talk to somebody, because sometimes you just do to explain it, you can call the PTC, and that number, if you don't have it, it's 1-800-475-5036. You also have the ability to, email if you don't need your answer right now. And you also have the ability for a support specialist to remote in to your workstation if there's something that you just can't get figured out and they need to help you with. So do that. I also started a YouTube channel called Eaglesoft University, and I have some, really amateurish videos on there, about Eaglesoft. So you guys can check that out as well. I'll put I'm going to grab my contact info so you guys can see that. If you do need to reach out to me, if you have any questions or, if you want to schedule me to come in and do on-site training or what have you, you can always contact me here. That's my number and my email address. But I think, in a nutshell, in a quick 3 hours, we went over kind of the basic stuff in Eaglesoft. So if anyone has any questions right now, feel free to type them in, shout it out. I'd be more than happy to answer any. Otherwise, you can stay tuned for, I'm trying to think when the next virtual user group meeting would be, probably in November sometime. So we'll get that information out. Yes, I am recording this webinar. And I'm going to go ahead, I'll put it on Eaglesoft University on YouTube, Rosie, and you can access that, or any new team members can access that from there. You're welcome. Okay, well, if that's it, I'm going to go let you guys enjoy your weekend. Happy Friday. You're welcome. It was a pleasure. I'm glad you could make it on, and have a great fall.